This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Being a nurse is a great privilege as my dreams have come true, and I am helping people when they need assistance most. For me, each day spent in the hospital is full of valuable experiences as I learn a lot every minute. Therefore, it is pretty challenging to think of the most valuable experience clinically. One such case was during my first days in the hospital when I had to work with a particular patient who was angry and demanding. Of course, I understood that the man was in pain and his irritation was due to his poor health condition, but he was quite abusive several times. I could lose my temper and tell him off, but I pulled myself together. I would come to his ward and complete my tasks, always smiling and talking to him. I knew about his significant concerns in a few days and could comfort him. We parted as old friends when he left, and he was grateful for my attitude. Now I know that I can find a way to every patient's heart to comfort him or her. This experience is closely connected with one of my preceptors. She was a great model for me as she was always cheerful and used humor as her primary weapon. She could communicate even with the hardest patients who seemed to try their best to insult healthcare professionals. I learned from her loads of valuable lessons. One of them was to be positive and try to find a path for each patient. Moreover, I learned to develop proper relationships with other healthcare professionals. This woman managed to gain authority among her colleagues and patients, and everyone was respectful. Another important thing I learned from her is teaching patients to cope with their health conditions. I noticed that those who refuse to move have more health problems than those who are trying to be active. Some of my colleagues said it was an attempt to complete fewer tasks, but I believe this is a good strategy that makes patients more responsible, more active, and, as a result, makes them healthier. Now, I am using lots of her tricks to develop relationships with everybody, and I have to say that she is a genius, as all these tools really work. As has been mentioned above, I believe I have chosen the right way, and I am a good nurse who can function in all sites. However, I think that the ward is where the nurse belongs. I like being with patients and try to spend as much time as possible with them. I believe that patients need our psychological help even more than clinical services, and I will detail that matter below. I admire nurses who work in intensive care units as they save lives, but the work is very demanding, and healthcare professionals do not have the right to make any mistakes. They also have little time to make decisions. For me, it is difficult, and I prefer working in less extreme conditions. I can work with people, and this is my advantage. I can fulfill routine tasks, but do not address patients with routing talks. I listen to them and share news, jokes, and emotions, and my patients appreciate it. Actually, this is connected with my aha moment. I used to think that clinical procedures were more important than psychological care, as medication helps people feel better and cures diseases. Nonetheless, one of my patients, as well as my preceptor, helped me realize that the psychological state of a person is much more critical. The woman was getting adequate therapy, but her health only slightly improved. For me, it was a surprise as I knew that the therapy was very effective and should have been very successful in that case. When I talked to the patient, I felt something was wrong, and she was depressed. It turned out she was living through a painful divorce. We started discussing this issue, and she decided to move on. Of course, medication may have improved her condition, but she felt much better and soon left. I often think about that woman and a tiny miracle that happened because of me. This was the moment when I understood that clinical procedures are only a part of a more comprehensive treatment. In conclusion, I would like to note that my experience will help me be a practical and successful nurse. I will provide high-quality clinical services and psychological support to my patients. I will also be capable of developing proper relationships with my colleagues. This is really important as proper communication among healthcare professionals enables them to develop the most effective treatment for patients. I will also remember my preceptor's words concerning the importance of being positive and optimistic, as patients need it most of all. I think I am ready to help my future patients cope with their problems and improve their quality of life. Did you like this reflection paper, nursing experience sample? To get more works like this one, make sure to check out the database of academic paper examples at ivpanda.com. You will find thousands of samples for all your study needs.